Hello, everyone. This is Dr. Michael, physical therapist. Hey, today we are here with the Mid South Pain Treatment Center. We'll be back in a few seconds, okay?
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.
Hello, everyone. This is Dr. Michael. We are back live. We're streaming in our podcast and our YouTube channel, of course, in our Alzheimer's and dementia support group. But we are here, obviously, here at our clinic, Jerry Have Physical Therapy. But we are here with Jillian and Jennifer. Jillian, I used to work with her somewhere in Jackson Meadows. Now she's with Mid South Pain Treatment Center. And of course, we got Jennifer. She's a nurse practitioner, actually. And we will ask them, what do they do? What are they doing with Mid South? And what is interventional pain treatment? So let's start with Jillian. Jillian, could you please tell us who you are, what you do again?
I am Jillian. I am the community liaison for Mid-South in Jackson. We are located off Highland in Greystone Square. We are interventional pain. We do not really do the pain med management that can accompany the interventional pain, but we do more of the blocks and the injections and ablations, and Jennifer can tell you more about that.
Cool. Well, before we go to Jennifer, I think we got the memo to wear black today, right?
I think so.
And whatever, if you're watching live, comment live, watching the replay, comment replay. But let's go to Jennifer. She's a nurse practitioner. Actually, we're streaming this too in our alternative career group. So she's a nurse practitioner, and maybe she can answer us some questions. So Jen, is it okay if I call you Jen? Miss Jen?
Just not Jen.
Jen, what's this? Okay. What is really interventional? What's that term for, with regards to pain?
So it's procedures that we do to help manage chronic pain, like spinal stenosis or bulging disc, herniated disc, things like that in your spine. And then also we have injections and interventions to help with like pain caused by arthritis.
So when you said the arthritis and stuff like that, do they just go directly to you? Do they need the doctor's order, their PCP?
It's best if they have some imaging and they can be referred over to us and we can work them up from there.
Do they need that imaging already, or can they do it in your clinic?
We can do it.
Okay.
We can do it. We'll just be able to get started a little bit quicker if we have that imaging available to review on that first visit.
How about the referral process? How does that work?
You can refer yourself technically. We just ask that you bring your medical records from your PCP with you. Often, though, the PCPs are the ones referring these patients.
Cool. So from the PCP, refer them to you.
The first visit's like a consultation. We will not prescribe pain medicines on the first visit. We will not do injections on the first visit. It's more about learning about you and your pain and what you're going through. And then the nurse practitioners will decide from there what the best way to go is.
That's good. Speaking of pain, I asked this to Jennifer. Jennifer, what is pain? Could you please tell us? I know that's the 6 vital signs, right? And then I know there's a lot of pain: physical, emotional, financial pain. So
Pain is a discomfort.
I know, right? So pain is a discomfort. So how do you? Is there like a standardized test that you guys do, like that pain scale, or?
We do use the pain scale, of the 0 to 10 pain scale.
Any other standardized special tests, like MMT, range of motion, or mainly more like a subjective pain scale?
Now we do a complete physical exam on the area that we're treating, and of course we check for any kind of abnormalities, swelling, or any like cracking or popping of the joints, and then what type of range of motion that they have.
Cool. Well, again, if you're watching live, comment live. If you're watching on a replay, comment replay. If you got any questions, type in your questions too, or send us an email or something. So you mentioned about cracking and popping. We call that crepitus, right? So when one person has a cracking and popping, let's just say it's the knee, what's the most common intervention or whatever intervention you do? Oh, That's the term, interventional pain. So what's the intervention that
So
you
of
guys
course our
do?
first step is more conservative. We try something like physical therapy
Ooh, physical therapy.
in order to try to get better
Do you guys,
strength
do you
and
guys
move.
have physical therapy in your clinic?
No,
don't.
we refer them out.
Exactly.
We need to put up a physical therapy
Yeah.
clinic there, right? So, just kidding.
Yeah.
Okay.
So we,
Mhm.
try more conservative treatments
Mhm.
first in order to get better range of motion,
Mhm.
hopefully improvement in pain, and of course better strength.
Mhm.
Whether it be balance or whatever. And then after that, we typically move to what they call an intra-articular steroid injection, which is an injection in the joint.
Mhm.
Of course, like I said, we do some anti-inflammatories and other medications that help. And then if they have an artificial joint and can't get that intra-articular injection, or if the intra-articular injection does not work, then we do a genicular nerve block.
Let's say that again.
Genicular nerve block.
Genicular nerve block. So there are a lot of approaches to the pain, right? First, obviously, the muscular pain. What they're talking about, what Jennifer's talking about, and Jillian is about the joint pain. So you got the muscle pain, you got muscle joint pain, which is the arthritis, right? You got psychological pain, all right? People who have stress. You got your brain, right? Your central nervous system. You got your peripheral nervous system. You got pain on those nerves too. Do you deal that with interventional with the nerve pain?
They can.
Mhm.
There's a lot of insurance issues there.
Okay, yeah. So it's a deep breath there, right? But when it comes to pain, you got your central nervous system. Under the central nervous system, you got your sympathetic and parasympathetic nervous system. When your body is in a fight or flight mode, when you're upset, when you're angry, you go in a fight or flight mode, which is called your sympathetic nervous system. Then everything kind of is inflamed. All right. When you're sympathetic upregulated, your blood pressure increases, your heart rate increases. Well, guess what? It's not just the heart that increases the pressure, your body too. Your muscular tension increases. That's why they give you muscle relaxant. Your nerve pressure increases too. And then you have developed those arthritis. And this is where they come in. Hey, what is it that really is causing your pain, Mrs. Smith or Mr. and Mrs. Smith? And that's where Jennifer comes in. They do a thorough evaluation. You check it from head to toe. Is it really muscular pain? Is it really nerve pain? Is it a bone pain or joint pain? Or is it more of a what you call a central nervous pain or peripheral nerve pain? I know you ladies are busy and I put you on the spot. Where can they find you? Do you have any phone number or fax or how they can send referrals to you guys?
Check us out on our webpage. I think he put it on there. It's www.midsouthpain.com. You can send referrals through there, and our phone number and fax number and everything is on there. And it tells all of our different locations.
How about you, Dr. Jen or Jennifer? Any last parting wisdom or where can they reach you to?
That number that and the website that she said
Okay,
will
cool.
get any of the clinics.
All right, good.
We have multiple locations.
I know, right? Where are your different locations in the area? You got
Tupelo, Germantown, Cordova, South Haven, and Jackson.
Wow, amazing. You guys are busy.
Yeah.
But before I let them go, they will have to answer all the questions again here, so they pick up a question and they answer it. So let's start with Jillian. Yeah, Jillian, I'll put you on the spot. So
who were your childhood friends?
Aw.
My best friend growing up, her name was Jinda.
Jinda?
Jinda.
What a nice name.
Yeah.
That's cool.
Where is she now?
She is outside of Atlanta.
Okay.
Yep.
Not inside, right?
Outside, not inside, outside of Atlanta.
How about you, Jennifer?
All right.
No cheating, okay?
All right. What's the best way to find out what you're really good at? Gosh, what makes you feel like you're good at it, and what other people say that
There
you do
you
a
go.
good job.
There you go. Well, thank you very much. Well, thank you for joining us in our little podcast and our show. But before I let you go and ask you any last parting wisdom that you can share for people in our group?
Come see us at Mid-South Pain Treatment Center.
There you go. How about you, Jen?
Come over and see us. We'll treat you right, help you out. We won't be mean to you.
There you go. Well, again, thank you very much. I appreciate you. But before I let you go, always remember the word FAST. FAST, letter F. Find people that will bring out the best in you because you are the average of the 5 people you hang out with. So who are you hang out with? That's going to be you. Today I hang out with the amazing Jillian and Jennifer, J and J. So hang out, specifically choose those people. You got to be intentional. If you're not intentional, guess what? You're like going to be a zombie. Zombie, like, they're not intentional. They're just walking around like zombies. You got to be intentional. Same thing with your pain. Same thing with your life. You got to be intentional about it. So find people that will bring out the best in you. Next letter is letter A. Take action. All this stuff that we're doing is not going to do me good. It's not even going to do the J&J good if you don't take action. Take action by going to their website, Mid-South. Just talk to them. Talk to Jillian, okay? Ask her, hey, Jillian, how are you? Ask her, hey, what can you do to help me with my pain? Right? Next letter is letter S. Share and subscribe. Share this episode because it may not be applicable to you, but it could be applicable to someone else. Guess what? 99.9% of the population experiences pain. I'm telling you now because everybody has pain, because that is really the sixth vital sign. All right, because people pain. There's a reason why God created pain. It's a vital sign. It's a check engine light. And telling your body, hey, there's something wrong, there's something going on. Okay. Last letter is letter T. Is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. So, again, thank you very much. Be awesome. Be great. Be excellent. We'll see you on the next episode of our Jerry Ab Show. Bye bye.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.